Dr. Brian Heaberlin here with Lexington ENT and Allergy, and I wanted to discuss a common problem that we see in the office, and that's nosebleeds or epistaxis. Nosebleeds are when the little small blood vessels that are in the nose, either in the front of the nose or in the back of the nose, break open and bleed. Many times the problem can be minor and self-limiting and stop all by itself, but we see people with serious nosebleeds that have to be managed either by cautery or by packing or other measures. Just wanted to discuss some of that. So if we look, most nosebleeds occur in the very front of the nose, and we call those anterior or front epistaxis. Some nosebleeds can develop in the back of the nose where there are larger arteries and veins. Those can be much more challenging to take care of. Posterior nosebleeds are more likely to occur in the elderly patients or people with cardiovascular disease. But most nosebleeds, even in elderly people, are the front nosebleeds or the anterior epistaxis. We will try to take care of these things in the office by cauterizing or using a chemical called silver nitrate that will seal the vessels and create a little small chemical burn that will stop the bleeding. And another important part of all of this is moisturization of the nose. So after someone's either been cauterized or even before, if they've had some minor nosebleeds, many times if we're able to keep it really moist, that can go a long way towards reducing or even stopping the nosebleeds. I like to use a small amount of Vaseline as long as it's carefully applied and not placed heavily where it can go down the back of the throat to the front part of the nose. Sometimes we'll use antibiotic-containing ointments like mupirocin ointment. That's a prescription that we can prescribe. Sometimes saline gels or saline nasal spray can be helpful. There's one called Air, spelled A-Y-R, nasal gel, or any other generic nasal gels could work. Those are a good safe way to moisturize the front part of the nose and try to reduce that irritation and keep things from bleeding as much. Sometimes people that have a deviated septum, that's where that center divider in the nose is crooked to one side or the other, that can cause dryness and irritation, which can then lead to the bleeding. So sometimes we'll recommend as a long-term therapy doing septoplasties if people have nasal congestion to try to help both improve their congestion but also reduce the chances of nosebleeds in the future. If you have a nosebleed that doesn't stop, you need to go to the emergency room or to your physician to try to get that taken care of. Rarely, tumors in the back of the nose or even in the front or middle of the nose or sinuses can lead to bleeding. That's certainly not a common problem, but it's something we definitely look for and evaluate when we're taking care of patients with nosebleeds. If there's any other questions or concerns, please give us a call or come see us here at Lexington ENT and Allergy. Phone number is 803-936-7530. Thank you.